We'll begin this afternoon by inviting Eva Kaili to open the presentation. Eva is a member of the European Parliament, a member of the Committee on Industrial Research and Energy. She's the first Vice Chair of the Science and Technology Options Assessment and a member of the Knowledge for Innovation group. And many of these groups have work that parallels the work that we would be doing in ITECH. For example, Knowledge for Innovation supports regulatory frameworks, fosters innovation, strengthens transparency, and focuses on quality of legislation, some of the aspects of which we have picked up in our ITECH project. So without any further ado, I'm going to invite Eva if she would come and make her presentation for us, please.
Hello, thank you very much for this invitation, and so I'm supposed to do the opening remarks, so I don't want to take much of your time because you know, sometimes politicians, we can talk a lot about things and not say anything, and now we have this amazing project going on, best practices that we see taking already place and taking advantages of the EU strategy plan. So I do believe that ITECH project is going to help towards that because it creates this strategy that will work in parallel with Horizon 2020. Sometimes, you know, we have professionals taking the funding, but then there is nothing left behind. So a strategy plan will help us achieve our goals. So as a politician, I have to tell you that what we care is, of course, economic growth and to reduce the spending on healthcare systems, so to be more effective. But at the same time, what we all want is not only to extend our lives, but to achieve healthy aging. So this new word now that becomes very familiar to you, of course, it's e-health and m-health, are words that we're trying to bring in the discussion in the Parliament. It's about information and communication technologies, the ICT, that involves instruments, the new instruments of how to improve our health. As you all know, chronic diseases seem to increase recently, and the epidemics, but we also managed to increase these technologies to understand where the epidemics take place. So, for example, an amazing professor of artificial intelligence that STOA brought in the Parliament was telling me how they can now, with the wearables and with following through the health applications, some symptoms, they can understand if an epidemic is taking place somewhere, if it's increasing. So we can very, very fast face it before it extends. So as you saw with Ebola, some things do not have borders. So we have to be ready, we have to work together. And what I think it's very important is for us politicians to put a lot of pressure to the Commission also, but to the member states, to keep the budget going and not reduce it, because we gave a huge fight a year ago to keep the funding of Horizon 2020 on research especially, not to be reduced, because we want the projects, but then if you don't have the research, you might have infrastructure that is no longer needed. As you all know, things that we are talking about here are already happening because the market is always more fast than we are in our decisions. So we run behind the market to try to create legislation and ensure the citizens that their data, personal data, will be protected. So I want to welcome this amazing event and tell you that we keep following exactly what you do, and we're very happy that it's so effective, and we have managed to work together now almost in the same speed, and we try to help to with our less regulation but proper regulation, because we have also problems like that. I don't know if I need to give you some examples, but I think it would be interesting. So we have the directive of 2011 really helped to have a cross-border exchange of information. As you all know, we're really worried about protecting citizens' data, and not because something might happen, because if somebody wants to get better, it's okay, they share their information. But then imagine that maybe very, very soon some companies could take advantage of your data and not hire you because you have a high potential of being sick or having a heavy history of problems of your health. And nobody will understand why they're not getting hired, or why you cannot be insured, or why you cannot have a pension. So these are extremely important issues that we have to face. We have to know that it comes with the technology. We cannot stop innovation. We cannot stop the data, the big data analysis, and we have to use them in a proper way. But also we have to be able to protect citizens from the negative maybe use of the market towards that. So also there is a big force that is taking place by the Commission, task force, which is extremely also helpful and very fast working. And I think you all know that there's already a call that is about to finish on April the 5th. It's about healthy aging. So we try to create a new industry, a European industry. So trying to create our own industry, not by copying best practices, but by creating our own. So we help and we fund the research, and we help people to come together in big consortiums that they can improve the quality of our lives. And so I think that we cannot even understand how far it can go and how fast, but this is why you're here. So thank you very much for inviting me too. I have to tell you that as STOA is the Science and Technology Committee of ITRE committee, which is Industry, Technology and Research, we're really working on that. So we try to be there for you if you have problems with the legislation, and to also answer all the debates and maybe worries that the citizens have. So the economic perspective is also amazing for Europe. You saw the crisis, the oil crisis, it might affect everybody, so we have to find new ways to create growth. It's a potential value of 16 billion worldwide, but EU is 1/3 of it, so it's like 20 billion. So this means we really have to work on that, and we have to be smart about it and fast, and help people that can do the research, and our universities and our think tanks. So we are also trying in the Parliament to work like you do, because as you know, we don't have a committee for the future or a strategy that would combine all the sectors. But we're trying to do that. We're trying to form a network of politicians that we will be trying to have a concrete strategy on where we want to go, so that we will be able to support you even better. So thank you very much. I'm waiting to listen to the speakers and to see how far this project can go. Thank you very, very much.